Hello, my name is Jeannie Sowell, and I'm a registered nurse, and I'm here to get your medical history. Can you please tell me your name?
My name is Robert Smith.
Okay. And Mr. Smith, what is your date of birth?
It is 9/4/1972.
Okay. And what brings you in today?
I'm here for a well visit.
All right. And who referred you to us?
I looked it up on the internet.
Okay. All right. And so we're going to talk about your medical history. What kind of medical problems do you have?
I have hypertension, and I have high cholesterol, and I think that's about it.
Okay. Do you take any medicines for your blood pressure?
I do.
Okay. What medicines do you take?
I take carvedilol.
Okay. Do you know the dosage on that?
10 milligrams twice a day.
Okay. And when's the last time you took that?
This morning.
Okay. Do you take it every day?
I do.
Okay. And do you take any medicine for your high cholesterol?
I think it's Crestor. Is that the name of it?
Yeah, that sounds right. That is a medicine for high cholesterol. Do you know the dosage on that?
10 milligrams twice a day.
Usually if this is just one time a day, they have it you on it twice a day?
Maybe it is just in the morning.
Okay. When's the last time you took it?
This morning.
Okay. Sometimes doctors have you take it at night, but they have you take it in the morning?
Mm-hmm.
Okay. And do you have any allergies?
Yes, I'm allergic to penicillin,
Okay.
sulfur drugs,
Okay.
codeine,
Okay.
and bee stings.
Okay. And what does the penicillin do to you?
It affects my breathing.
So does it make you wheeze, or does it?
I don't know. My mom's always told me that I was allergic to it, and I've never witnessed or remember a reaction to it.
Okay. And do you know what sulfur drugs do to you?
I don't. It's another thing that my mom just told me that I was allergic to.
Okay. And what does codeine do to you?
It does the opposite. It makes me hyper, and it acts the opposite of what it's supposed to act with me.
Okay. And what are the bee stings? What's your reaction to those?
I don't have a real bad reaction. I just swell up. Usually I can fix it with Benadryl. It doesn't. When I was a kid, I had it, but I went through the shot regimen and got desensitized.
Okay. When you say swelling, is it all over or just for the bee stings you?
Just where the site is.
Okay. And so it's bigger than, say, a normal person would have?
Yes.
Okay.
And the same thing with mosquito bites and anything that's like that. It's bigger than normal.
Okay. And so what do you do to try to avoid having a reaction? As far as
I stay away from bees.
okay. All right. And do you have any allergic reactions to foods?
No.
Okay. What about latex? Any latex allergies?
No.
Okay. And going back to the medicines, do you take any over-the-counter medicines?
Yes, I take an aspirin a day.
And what's the dosage on that?
Just the baby aspirins, whatever they are.
Okay. And that's once a day?
Uh-huh.
And do you take that in the morning?
Yes.
And did you take it today?
Yes.
Okay. And do you take any kind of vitamins or herbal medications?
I take a multivitamin every day.
Just like a regular. Okay.
Right.
And do you take that this morning?
Yes.
Okay. Okay. And have you ever had surgery before?
I have. I had my gallbladder taken out 2 years ago.
Okay, so that was 2017.
Mm-hmm.
Okay. And did they do that through the little cuts to the laparoscopy? Okay. Any other surgeries that you know of?
Nope.
Okay. Did you have any problems with anesthesia?
No.
Okay. Do you have any family problems with anesthesia?
No.
Okay. And do you know of any childhood illnesses you had that maybe your mom told you about?
No.
Okay. Now, any mental health issues like anxiety, depression, anything like that?
No.
Okay. What level of education have you had?
High school.
Okay. And what kind of job do you have?
I'm a security guard.
Do you have any kind of hobbies?
I like to go for walks in the park.
That's good. That's good. I want to ask you about your family history. Do you have any brothers and sisters?
I have one sister.
Okay. Does she have any medical problems?
No.
What about your parents, your father or your mother?
No, they didn't have any problems.
And then what about your grandparents?
Both my grandparents died from heart disease.
On your mom's side or your father's side?
On my mom's side.
Okay. Do you remember about what age they were?
I think they were in their 70s.
Okay. Okay, and as far as your father's grandparents, did they have any medical history?
No.
Okay, and just I want to ask you some things about your lifestyle type things. Do you exercise?
Yes.
Okay. What kind? And I know you told me that you like to take walks in the park. Do you do any other kind of exercise?
I walk on the treadmill for about 30 minutes, 4 days a week. And I follow that up with, I do about 30 minutes each day. And I follow that up with some weightlifting for about 20 minutes.
And is that 4 days a week also?
Mm-hmm.
And are you on any special diets?
Mm-hmm.
Do you have a history of any kind of cancer? Okay, is there anything else you can think about as far as your medical history that we haven't talked about?
No.
Okay, so I'm just going to go through the different body systems and just ask you about that. Maybe it'll trigger something you haven't thought about, or
Okay.
so. Do you have any problems with your skin?
No.
Okay, so no moles, no sores or anything. Okay. And then any problems with your ears, nose, throat?
No.
Okay. Do you wear glasses or contacts?
I do wear glasses
Okay. And
and contacts.
Okay. And do you have any kind of hearing problems?
No, I hear perfectly.
Any kind of heart problems? I know you taught me about the high blood pressure. But have you ever had a heart attack? Do you have irregular heartbeats? Anything like that you can
No.
think of? Okay, I know you told me you have high cholesterol. Any kind of lung problems? Asthma, bronchitis, pneumonia?
No, not at all.
Okay. Do you have sleep apnea?
I do not.
Okay. Do you have any stomach problems, such as indigestion, acid reflux?
Sometimes I get indigestion, but I just take some like over-the-counter Tums and Pepsid for that.
Okay, and that takes care of it?
Uh-huh.
Okay. How often do you have to take the Tums?
Just once a week or so.
Okay. And the Pepsid, is that over-the-counter Pepsid?
Uh,
Okay. And how often do you have to take that?
just once a week.
Okay. Do you know the dosage on that?
I know.
Okay. And have you ever had a kind of colonoscopy or anything like that?
No.
Okay. Any problems with your bowel movements?
No.
Okay. It's regular. No problems with constipation or diarrhea. Okay. Any kind of urinary problems? Do you have to go to the urinate frequently, or during the night, or anything like that?
No.
Okay. And do you have any kidney problems? Have you ever had kidney stones? Do you have kidney disease?
Mm-mm.
Okay. Any problems with your genital area? You know, with your penis or your scrotum, any swelling or anything like that?
Mm-mm.
Any kind of vascular problems, like with your hands or feet, any abnormal coldness, anything that you can tell me about?
No.
Any problems with varicose veins, that kind of thing?
No.
Okay. Do you have any problems with your muscles or your bones?
No.
Okay. No arthritis or anything like that?
No.
Okay. Okay. And Mr. Smith, I wanted to ask you, do you use any alcohol?
No.
What about any recreational drugs?
No.
Have you ever used any alcohol?
Not for 20 something years.
And have you ever used recreational drugs?
When I was in college, a long time ago.
Okay. Let me just verify then. You told me that your education was high school. So did you?
I just didn't graduate.
Okay. Okay. So some college. Okay. All right. Any kind of neurological problems like numbness or tingling in your fingers or toes, seizures, migraine headaches?
No.
And have you ever had a stroke or anything?
No.
Okay. Do you have any problems with your blood, like anemia, low iron? Has anybody ever told you you were a free bleeder or anything like that?
No.
And do you have any kind of problems with your endocrine system, such as diabetes or thyroid disease, anything like that?
No.
Any diseases of your immune system, such as lupus or HIV?
No.
Have you been outside the U.S. in the last 30 days?
No.
Have you been around anybody that's been outside the U.S. in the last 30 days that's been sick?
No.
Okay. Is there anything else that you can think of that I didn't ask you about that you need to tell me about for your history?
No.
Okay. Well, thank you very much, and we'll get the rest of you checked out for your wellness visit. Now, Mr. Smith, there was just a few things that I didn't get to ask you the first time, so I wanted to follow up with those. How tall are you?
I am 5'10".
And do you know how much you weigh?
About 300 pounds.
Okay. And then I forgot to ask you about your immunizations. Did you have all your childhood immunizations for school?
I did.
Okay. And then, can you tell me, do you know when your last tetanus shot was?
It was in 2017.
Okay. And
I was going out of the country and I wanted to get a booster shot. So it was, I think, June of last year to prepare me to go out of the country.
okay, so June 2017?
Mhm.
Okay. And have you ever had a pneumonia vaccine?
I have. It's been about 3 years, I believe.
Okay. And then the flu vaccine, did you have it this year?
I think I had it earlier around October, November whenever they first started giving them out at the doctor's office. That's when I took it.
Okay, of 2018.
Yes.
Okay. And when you said you went out of the country, did you get sick or anything when you were outside the country?
I had some pretty bad diarrhea while I was there. It was what they call Montezuma's Revenge. I went to El Salvador on a mission trip, and it was a remote location, and the food or the water or whatever it was got me.
Okay.
When I got back, it took about a month to get over it, but I'm fine now.
Okay. And did you have any follow-up with your doctor about it at that time?
I did. They ended up putting me on probiotics, and I took those to get my system back normal, and it took about, like I said, about a month. And
Okay. Oh, okay. And did your doctor do any further testing when you were there?
they did a stool sample, and to make sure I didn't have any kind of critter up in me, however you want to call it.
Okay.
But everything was fine. It was just
Okay.
drinking the water, I guess.
Okay. Great. So, do you have any questions for me about anything?
Nope.
All right. Thank you very much.
Thank you.